Good evening, everyone. Thank you all for joining us in the first ever webinar of GAIMS Tamilnadu. Today we have the topic virtual reality technology in healthcare monitoring. So we know that you are so excited to ask a lot of questions in the topic. You can ask all the questions in the comment section and we will answer all your questions at the end of this video. So to enlighten us in this topic, we have Professor Dr. Aruzhmozhivarman joining us here. So to give a brief intro about him, he is currently working as a professor in the School of Electrical Engineering, VIT Vellore in Tamil Nadu, and he has served as the Dean of School of Electrical Engineering during the period from December 2015 to 2018. He has completed his PhD degree from NIT Trichy in 2005, and he has guided various research papers. So also he has handled a couple of DRDO, ISRO and DST projects in the area of photonic sensor development and image processing domain. He's in several international conference proceedings and he's a reviewer of International Journal of Computer Engineering Research and IEEE Photonics Technology Letters and IEEE Transactions on Neural Systems and Rehabilitation Engineering. So he is also a senior member of IEEE Signal Processing Society. So over to you, sir.
Thank you, Aravind, for the nice intro about me. And first of all, I would like to thank the GAIMS, that's a Global Association of the Indian Medical Students, Tamilnadu, for arranging the webinar and bringing the technological area into the medical domain. It's a great service to the nation as a whole and also for the service to the entire world. First of all, I would like to appreciate and thank all the doctors and the frontline workers like the medical professionals for providing extraordinary service during the pandemic situation, and you are called as a Corona warriors, and we really salute all the medical professionals for the great service to the entire world. So it is the thankless service you people did. So as a token of the appreciation from the technological domain, so we would like to thank all the medical professionals for the great service. With this, the intro note, let me talk about the today's topic. It has been guided and provided by the GAIMS. So virtual reality technology for the healthcare monitoring. So I will be addressing the specific technology interventions. I am going to highlight what are all the technological interventions that we are going to deal about. Please, you can look at the presentation thing. Is it visible? Sir, my screen is visible?
Yes, sir, your screen is visible.
Good, good. So the focus of the talk today is talking about the technology interventions and what is the technological understandings of the concept and how it is impacting the healthcare sector. What is the contribution to the virtual reality based the healthcare monitoring from the end in collaboration with the Dr. Aravind Eye Hospital Pondicherry. That's where we are going to address about. Okay, so thanks for the Dr. Aravind the nice intro about the career. So currently I am serving as a professor in the School of Electrical Engineering, VIT Vellore. So this is the background of my presentation thing, what I addressed so far. So today we are going to deal about the technological interventions in the medical field. So especially we are going to address the virtual reality, augmented reality, as well as the mixed reality. So out of that, we are going to focus more on the virtual. Let me give the background of the concept, how it has evolved for the technology interventions, bringing into the virtual learning environment. So providing the simulated domain on the specific level of the image reality. So that is what we are trying to bring it out in terms of the technological interventions. Today, when you look at the current educational circumstances, the people are trying to bring out the benchmark or the golden standard from all the best practices or the best level of the preparations. So by making use of the inter and the intra level of the observer level of the features, and creating a mental model which is developed on the preparation of the various level, for example, the plastic teeth, and the internal model which is not based on the pathological level of the thing, but creating the virtual scenario around that, and the problem solving, that is the another important aspect that has been dealt under the virtual reality aspects. Some of the clinical problem solving, the people have looked into the more depth of the pathology and the preparation design, which are collectively integrated. Okay, so why the changes are required in terms of the educational circumstances? When you look at the educational reasons, what the people are thinking as their learned level of the observers. So they are trying to improve the integration of both the theory as well as the practices, the process and the outcome evaluation, incorporation of the problem solving in the preclinical training, practice in the realistic context, closing the gap to the clinic. This is where the technological intervention, why they are felt that it is very much important in the today's context. Coming to the practical reasons why the changes are required, especially for the virtual reality, augmented reality, and the mixed reality level of the concept to the healthcare sectors. The practical reasons are the reduction of the maintenance costs of the various aspects, no waste of the materials, no water problems, and the unlimited availability of the practice material. So we don't require for the real level of the material. So everything can be synthesized and you can play around in a 3D level of the environment. Okay. Coming to the practical skill development that carries for the treatment thing is, so one can have the clear understanding of the accurate and the realistic 3D simulation of both the manual dexterity and the pathological level of the concept, and more level of the touch feel through the haptic and the realistic images, realistic mental modeling, muscle memory, and the proprioceptive training level of the options. So there are a lot of integration that the people are trying to put through the computer level of the simulation by incorporating the existing and the present knowledge expertise into the virtual environment. As a user, you can really get the realistic interaction with the virtual patient, simulation of the space limitations with whatever the applications deals with the tongue, cheek, or the patient's level of the perceptions that can be incorporated. So what the advantage when we are dealt with the virtual level of the imitations into the real world scenario is, one can combine the integration of the techniques and the theory. We are going to look at the why the intervention is incorporated as the advantages for the healthcare sector. Unlimited practicing in a safe and almost real life situation. So there are practical issues where one cannot go for a look at all the level of the operation aspects in every students of the medical practitioners. So there are the space restriction, there are the time restrictions. So that has been taken care by making use of the complete virtual level of the imitations. The level of skills you can easily adapt and you can obtain. So those the things will really help to save the material, equipment, and the staff. Okay. Let me bring out some of the technological interventions we have addressed: augmented reality, mixed reality, and the virtual reality level of the concepts. The first aspect what we are going to discuss and the deal about is the augmented reality. Why it is important? and how it is important. The people in the professionals, they are brought out the various technology interventions, especially for the defense and the medical domain, so that it can get expertise and gained into the more usage into the various aspects. Then the people are introducing to the various other domains. Likewise, when we look at this, the technology interventions, librarians are usually the trend centers of the technology, because they foresee the technology level of the interventions and how that can be used in terms of the various level of the learning modalities. So there are various level of the examples in terms of the augmented reality in the medical education. When you browse that the PubMed and CNAHL, so you can see really approximately 578 results with the simple search of the augmented reality. So there are the technological is heavily deployed into the various level of the medical practitioners. The AR health apps which are available for the consumers. There are n number of the website which is providing a open source software for establishing the augmented reality. Look at this, the augmented reality which open up the doors for the various level of the application in the medical domain. So as a users and as a medical practitioners, you are permitted to freely download from the various things, starting with the anatomy and the human body education. Then you can explore for the heart functioning and the brain functioning and the more depth of your the understandings by learning, by doing or the practicing in terms of the augmented reality. So about they came up with the heart of living to understand the heart risk. So again, this is the complete level of the augmented reality app. So you can download and you can utilize and you can give the feedback. So what exactly the augmented reality is talking about, how it is working. So one can connect the real world with the marker, and where you can exactly play around with the real world scenario through the markers, and you can look at the information through the virtual level of the content. There are software tools to augment and develop the augmented reality level of the thing. So there are multiple level of the softwares that are available. So starting with the parallel tracking and mapping, and you can look at the Unity and Envisage and all the thing. So how it has developed. So I have listed out some of the software package, how it supports, and what are all the URLs that you have to look at, and what exactly the experience that you can gain as a beginner, as an advanced level of the development by using the augmented level of the reality. Okay, now coming to the technological background for the virtual reality. This is another technology intervention I have mentioned in my first slide. So where we are talking about for the virtual reality as the illusion of the three-dimensional, which is interactive and computer generated reality, where the vision, that's a sight, sound, and sometimes even the touch, the whatever the haptic level of the thing, which are simulated to create the pictures, sounds, and the objects which are actually seen real. So we are going to see some of the case study what we have developed, and so what is the application in the real world scenario, that also you are going to look at. So look at this, the virtual reality. It is one of the buzzword, all the technological interventions that people are talking about. It is the illusion of the three-dimensional, interactive, and computer-generated reality. So how we are making use by using the vision, sound, haptic, and also sometime whatever you are the other level of the sensing ability, like the electronic nose and all the things. Okay, what is a major concept in which the virtual reality technology that has been used is which allow the user to view the environment from any point at any angle. That's a key, that's an advantage. So where we are going to replace the bulk level of your the health examination unit or the monitoring units by providing a simple handheld and the head mounted level of your the units. Even that can be supported for the ICU patient. You need not to transport the patient to for the sake of the measurement or the study or the diagnosis. How the technology helpful for the various level of the applications. Again, the VR must allow the user to interact with the objects in the environment. So one can also look at this as a gamification level of the development, but in the current scenario, so everything is looking into the technological level of the advances in terms of the medical applications. When you look at this, the historical development of the virtual reality, starting from 1960s, the first head-mounted display and the head tracking system, which has been introduced by the Ivan Sutherland. Later, the Massachusetts Institute of Technology, MIT, so in the Boston. So they started looking into the various perspective of the virtual reality. In the two different level of the project that they have focused. One is they put that there, and the other thing is the Aspen movie map, where the VR concept has been heavily understood by all the technicians, and they have started building those the technological advances. UNC later in 1986, they came up with the virtual world term. So they worked out the walkthrough and the pixel flow nano manipulator level of the systems for the various other applications. We are going to look at how practically those things will be helpful for the medical community. Then the NASA Research Center, they came up with this head-mounted display and the various other applications by incorporating the spatial sound and the super cockpit. Next comes for the VR hardware and the systems. They brought out the reality build for the tube and the body electric. And later, once the people start looking into the environment and the spatial information, why don't you feel as a user in a particular environment? So they establish an immersive level of the virtual reality by incorporating the haptic and also the vision as well as the sound, and get that the special purpose level of the field presence in terms of the real world scenario in the virtual level of the concepts. So the concept has been further established in terms of the communication domain. The people are now today talk about for the telepresence in terms of the multiple scenario, especially for this the pandemic situation. So every day the people are using a teleconferencing, but the telepresence is something which is interested, like the United Nations or the any G20 country. They are organizing the meeting and in a remote positions, and then they feel as a telepresence in a real-time level of the telepresence, where you provide that the every level of the country's head sitting each other next to them, and then they are addressing for the very important level of the points of the governance. So that they are bringing in terms of the real world level of the object into the telepresence thing. There are the concept because of the asynchronous level of the mode, the people have the delayed telepresence by using a recorded, then after satisfaction of the applied level of the real world scenario, they can brought out these things. Even today, the as a presenter and the other attenders, the Microsoft Teams, you have the option for as the global view in terms of the telepresence level of the features. So one of the very important level of the augmented VR is the computer generated inputs which are merged with the user's view in terms of the real world. That is where the even with the automotive sectors and also for the all the other level of the healthcare industries, so they effectively work at the augmented level of the VR. So what exactly we required in order to establish these things in the real world level of the scenario bringing into the virtual world? So we need to have the set of hardwares so that primarily support for the user input interface. So either your command through the vision or the audio or the touch feel or any other the olfactory level of the interfaces like the smell and other the things. Then you should have the tracking interface where you have to focus on the target positions, and then you have to get the visual cues and also for the audio cues to move further. So you need to have the visual interface, you need to have the auditory interface, you need to have the haptic interface and the olfactory level of the interfaces. So the primary interface or the keyboard or the mouse or the joystick, where the 3D pointing devices, sometimes the people use effectively the spacebar, cyberband, ring mouse, and the EGG. So these are all the major level of the primary interface that has been effectively used. In the visual inference, the field of view. So whatever we are looking into, the humanized system. The similar way for the visual inference, so we required what is the maximum field of view we can cover, and what is the image resolution that you can look at, what is the refresh rate. So in a real-time scenario, we can talk about 25 frames per second is the live level of video informations. So that gives the seamlessly your connect for the every activity. So that's where we talk about the refresh rate. Anything happening within the 40 millisecond. So that you are maintaining it in the perfect recording thing, then it is a live coverage of the event. The similar way for the brightness and the color perspective. So one has to look at in terms of the visual inference. When you move further, the visual interface for the real world scenario, bringing into the head mounted and the virtual reality mode. So you need to have the HMD. HMD, you have the multiple level. So where we have the VR 4000 or the eyeglasses or the data visor or sometimes the book. So there are various level of the head mounted level of the display systems that has been effectively used. So with this, the background, now we will come to the very important aspect to touch upon the today's webinar session, focus on the how the VR technology impacts on the healthcare monitoring. So we will look at some of the very important findings and the details in depth. Then we will go for the one case study, what we have exactly performed for the glaucoma screening by using the visual field perimetry device. Okay, so virtual reality, which impacts our usual lifestyle, which is totally affecting in the today's scenario. So you can look at the Statista research, the AR and the VR, which estimate their share. So you have to look at the market values and the current scenario. 193 billion US dollar, that is almost 16 times more than in the 2018. So now this technology intervention is dominating in the medical sector, especially for the healthcare monitoring. So such a rise of the augmented reality and the virtual reality market. So you have to look at what are all the application field in the today's scenario. It almost it is affecting right from the entertainment world to the all sort of the industry. Whether you are in the automotive sector or you are in the entertainment world or you are in the different level of even the survey level of the domain or the tourism or the hotel management or the architecture, or if you talk about for the real estate, any retail level of the things, gamifications, or the whatever you are the driver experience you want to get the feeling. So everything the people have talk about for this the VR and the AR based thing. Especially in the healthcare, it is inevitable and inexhaustible. So the impact in terms of the healthcare sector, when we focus more on that, so the VR is greatly affecting in the all the advanced levels of the healthcare level of the industry. So let us look at how this is taking into the various medical niche areas in terms of the applications. So it has been indelible improvement in the health and the general lives of the people by looking into the various level of the applications, especially when the patients with the deficiencies like the autism, lazy eye, or even the low vision, the chronic pain and the other health conditions have the VR. So it is the greater application in terms of the sphere of the health influenced by the VR in the most affected level of the domains are the psychology, medicine, neuroscience, physical and the occupational level of the therapy, mental health therapy, motor and the cognitive skills rehabilitation, clinical skills level of the training activities. When you go deep onto this, the application, so especially for the VR and the AR based level of the solutions, so you can look at this, today's technological governing bodies in the world. So that is the Google, Microsoft, Sony, Apple, NVIDIA. They have invested the huge level of the billions and the billions of dollars on the VR device based the medical industry applications. Okay. So the VR based level of the thing, especially for the doctors and also to support to the training activity, especially for the human anatomy, practice and the operations, the technology infections control is effectively used. So VR inclined device platforms, which is developed by the Precision Genomics VR, Anatomy.A VR, and Airway EX virtual surgery simulator are the major examples for the medical training and the education using virtual reality technologies. So some of the well-established medical institutes, they have the privilege of this having this VR-based level of the surgical simulators, especially for the pre-treatment level of the planning, the people are effectively using for this. Coming to this, one of the critical level of the application where all the medical practitioners should gain the knowledge of the surgical level of the process. Today, when you look at that, the learning experience is very, very important. Even all the curriculum of the medical sectors, people call it as the experiential curriculum, because the education of the medical students is need to get the better experience and better hands-on. So that is one of the important thing. So only a few medical students in the realistic level of the approach where they can able to attend the operation and learn the process at a time. There is no room for every student to study and looking over the shoulder of a surgeon, because it is very difficult. And in order to compensate those the hands-on and the real-world experience, this the concept of the virtual reality and bringing both the learning and the teaching experience of the medicine in a higher level, in a more advanced level. So such operation using virtual reality camera exercised by the cancer surgeon Shafi Hagmadan. So he started utilizing on the 14th April 2016 at the Royal London Hospital. So this is the image. What you are looking is during the surgical process. So the doctor has used, and that has been streamed to the all the level of the other practitioners. Next, coming into the VR-based mobile application for the various level of the disease level of the treatment procedures and also for the guidelines, the people use the VR medical app. Okay, so these virtual medical games sometimes will help for the rehabilitation centers, especially the patient has to get rid of pain, because when they perform for the exercise for the stipulated duration, so there is a gamification which is also introduced, and when they achieve it, so they also feel that it is not boring, and they are getting the more encouragement in terms of performing it, and they are coming out of the phobias, speed up the rehabilitation, and which really help for the medical level of the practitioners to study about the patient performance, so parallelly, and they can record. Okay, so VR apps act as a surgery simulator, and also for the meditation support for the disabilities, and also for the whatever the level of the support which is needed for the need is. So this has been effective tool. So again, the Royal College of Surgeons in the Ireland, they established the VR mobile app. Keep in mind, this is the surgeons, they put a lot of effort and bringing out the mobile app for the medical education. So without any medical background, the people are now learn this the concept in a more effective way. Next, coming to the pain management and the relaxation with the virtual reality applications. So the medical VR, which is again very, very helpful to understand the brain process, and also the pain connected factors associated with the activities. So this is very much helpful, and it has been proven by the University of Washington HIT lab. So the patients are engaged with the virtual reality, and they felt less pain when they are compared with the normal level of the medical procedures. Okay, so that's where they felt happy that the pain management and the relaxation using virtual reality level of the tools. So again, look at this, the physical therapy and the rehabilitation. So the patients perform with the 30% of the regular exercise when we brought into this the VR level of the combinations into the physical exercise. So there is a tremendous improvement in terms of the performance activity and the day-to-day engagement. So that is where the concept of the virtual reality bringing to the very important thing, especially for the neuro impaired level of the people. So it is effective for the physical therapy and also for the various level of the thing. So it has been developed by the HTC Vive. There are the VR based level of the solutions for the phobias and the post-traumatic level of the disorders. Virtual reality, which removes those the fears and the phobias in terms of the post-traumatic stress disorder level of the people. So this Bravi Mind, they brought out the VR-based mobile app, which is developed by the University of Southern California and Institute of the Creative Technologies. So they supported for the phobias and the post-traumatic level of the disorder level of the patient conditions. Trauma patients, especially for coming out of the issues, so that was very effective. Next, the cognitive recovery and the rehabilitation with the VR. So this virtual reality aids which speed up the recovery and the cognitive level of the rehabilitation. Sometimes the motor cortical level of the activities that has been effectively initiated when the people are effectively using this VR based level of the tools. So patient can interact with the virtual environment and practice some of the tasks. So when they have to come out of the issues. So virtual reality based neuro rehabilitation gaming, which is really helpful to bring out the cognitive and the motor level of the issues in better positions. This is the very important and the vital to bring out the low vision level of the people to get at least a reasonable level of the manageable high vision. So that's where the VR is highly handy in terms of the low vision level of the people, where due to the various reasons, so you can look at the figure, there are 135 million people globally suffer from the low vision. The saddest part is that cannot be corrected by the surgery or the medicine or the glasses. So they need to get back the rest of their life period. So through any level of the technological interventions. So VR is really supporting age-related level of the factors when the people having the greater than the 45% of those the issues, and then the people affected with the any eye injuries or the disorder like the diabetes with the long-term level of the thing, or the level of the permanent loss of the certain thing, or the serious level of the low vision issues, then they can able to recover through this the VR and the AR based level of the technology. So currently the iris vision, so they have provided this the complete level of the vision assistance by using this the low vision level of the people. So especially this the VR based level of the glass. So that has supported, and it has been tested by the John Hopkins School of Medicine and the Stanford University. So now in VIT, we are also parallelly working in collaboration with the John Hopkins for the low vision level of the patients, especially for the Asian countries. Using VR in the dental practice, it is a common practice for all the dentists, and they work a lot by using a virtual prototype of the patient mouth, and also for the pre-treatment level of the tricks, because there will be a complicated level of those the dental surgical process. So they need for this the virtual environment and also the pre-treatment level of the planning conditions. And the lot of level of the advantages when we provide the VR glass to the dental affected patients. So that helps the people to think about something in a different way, so they can come out of the fears or the pain of when during the surgical level of the process. So there are the patient evaluations, psychiatric care and the behavioral level of the interventions people are using by using the VR level of the interventions. They measure the performance of the cognitive and the other behaviors. So by looking into the VR performance, especially the psychiatrists, they look at the behavioral level of the activity. So this is as a part of the treatment of the phobia and the chronic pain. So they can effectively use the technology. So the VR as a whole benefits the entire medical field. So what is the key factor or the characteristic we can look at this the virtual reality technology interventions for the medical domain is one is the reducing the training cost, especially for the every individual you need to train, and that has been taken care by this the technology intervention, especially the VR, and reduce the error. So the whatever the human error, even if the error happens, so that won't cost any of the human lives. So then they increase the confidence of the doctors or the medical practitioners, and store the patient data digitally so that you can play around those the CT scan or the MRI report, and then you can bring into the three-dimensional visualization, and then you can locate specifically in terms of these spatial locations, and you can perform the accurate level of your the surgical thing. And it greatly helps for the surgeons to reduce the surgical time, to understand the locality of the issues, and also for the depth of the information they require for the surgical process. It really improves the accuracy, and which improves the communication in terms of the real world scenario. So it also supports for the patients, because there the recovery time is faster because of the various safety features which has been adapted before you are performing for the surgical procedures. So you can understand the process that is happening in terms of the VR in the medical field. The first thing is we should know that the medical objectives, what purpose we are utilizing it. So you need to have the complete background information of the procedures, and you need to select the hardware and the software that can support to look at the fundamental problem which are associated with the background details. Then establish the 3D virtual data and the virtual environment. then make use of the virtual reality level of the models. And once you thorough with this, the interventions, then you can have the exact planning of the treatment and proceed for the actual level of the surgery. In a more technical way, how this concept has to be established as a background level of the thing is, this is how the complete VR system has to be established. Once you know the application specific programming as the technologies we support for the whatever the background in which the concept has to be built, then the related modeling is built around that. Then the 3D graphics model with the textures, with the dynamic generators, and the rendering has to be done. Once that is there, then what are all the interface has to be done, whether it is the vision cue or the audio cue or the haptic or the outflow factory or the different level of the thing. So all these the interventions by using the key interfaces we have to perform, and finally we can make it as a complete level of the VR system. So this is the background in which what I propose so far as the virtual reality technology for the healthcare monitoring. So with this, the background and with the understanding of our virtual reality technology, so we approach with the Aravind Eye Hospital. So I should really appreciate the BTech students, because when they are in the second year, they have started interacting with the Dr. Venkatesh, Chief Medical Officer, Aravind Eye Hospital, Pondicherry. And as the subject connected project activity, I assigned them to visit the hospital and observe that what the issue currently the doctors are facing. Then they come out with this the specific problem called as the visual field perimetry study. The gold standard is the Humphrey field analyzer. So later part of this slide, I am going to show that. So the background here is, currently we are having the government funded project, that is the DST is supported. We have brought out the completely indigenous design and developed, and now it is reached the TRL level, technology readiness level. As per the NASA standard, it is ready to go for the commercialization level. So this is a C3 field, what we named as the compact and the comfort and the cost effective. Okay, so it's a head mount portable device for the visual field perimetry. So our industry partner, can you look at this? This is a alpha layers technology. The CEO is our own student, so Mr. Sandel. So he did the BTech electronics and instrumentation engineering under my guidance. Okay, so he has established, now he started his own level of the entrepreneur journey as the alpha layers technology. So he came as an industry partner, and then now we are launching the product to the global. Okay, so there are the multiple level of the test trials has been done in terms of those the field of view study and the more level of the realistic features with the high resolution measurement thing. And we have incorporated by using initially with the Raspberry Pi level of the model. Now we have come up with all the hardwares and the software level of the supports with our own level of the development. So let me show this the basic level of the measurement criteria in terms of the luminance and the field of view level of the aspect. Coming to the state of the technology, that what we have developed is what you are looking into the column number 1. We talk about for the various functional features and the state of the technology in terms of the unit and the price, portability, field of view, testing strategy, stimulus variation, and the patient comfort and the normative data. So you can look at that. This is the developed system, C3 field analyzer. And there is a gold standard for the visual field perimetry study, that is the Humphrey field analyzer. And the next one is what the people have used, the Octopus perimeter. So when we compare the price, is we brought down from the 15 to 20 lakhs of the Humphrey field analyzer into the 3 lakhs. and portability is very much possible. So even you can go for the any level of the higher level of the screening requirements, so you can go. Then the field of view, which is support for the whatever you are the testing, which is much level of the useful for the head mounted level of the technology. And the doctor says that this the degree now we are stretching till the 36 degree. Okay, so that is the best possible level we can demonstrate, and that is very much useful for the screening and also for your the testing thing. So it is all for the glaucoma screening and the thresholding levels. We have followed those the procedures, and the cost per test you can look at by the comparatively it is very less when we use, and the patient comfort is very high. And especially for this the device, we established the Indian population, especially for the normative data. So we have taken from the different population after the ethical committee concurrence with our own faculty, research scholars, and the students. And now we have done for the multiple clinical trials. Now we are in the final level of the clinical trials with the Aravind.A. So this is the background of our the visual field perimetry development. Look at this, the product with the more features, which has the built-in data storage, and we have the seamless duration of 20 millisecond, and the number of test location are the 74. Now we have increased, and so that we can get the better level of the field of view and also for the peripheral study. The important aspect is the supra-threshold analyzing. So that is what we have done, and now we are going for the full threshold study also. Then coming into the various level of the feature is the we are with our own in-house database that where we have developed the software as a C3 field of view. The new observations we are compared with the HFA, that is the Humry field analyzer, with our the CFA for more than 150 patients, and we have analyzed those the statistical study. And this study has been collectively done by the John Hopkins and the VIT, and finally we have presented our work in terms of those the publications. Okay, so this is the indigenous level of the normative data. That is the more advantage for us to understand the Indian population for the better performance. And this is the our the references. So before I can conclude, let me demonstrate a few videos of our the technology development. Then we can invite the whatever the questions consolidated by the GAIMS. So let me move on to this the video presentation. Can you look at this? This is a C3 demo. Sir, my video is playing?
Yes, sir. It is, yeah, it is playing, sir.
Yes. So the patient with the any sitting position, so they can able to perform this the visual field perimetry, especially for the ICU patients and for the any level of the neuro level of the patients. So they cannot come and sit with the fixations for the any specific positions. So this system is the quite handy and it is highly supportive. So patients initially introduced with the demo, and then they can perform for the actual level of the sample collections. So all the voice assistant guidance also there. So you can perform visual acuity and all this study. And there is a stimuli point has been generated, and it is a subjective level of the testing. At the end, the patient visual field analysis report has been come through the wireless way, and then we can take the report. So it really helps for the telemedicine level of the thing, where the mass screening you have to go for the villages and you have to perform for the study. So you can get the visual field perimetry studies. So this is a unit that has been developed by the VIT. Now let me show this another demo what we have come out. This is the next level of the version development. This is a subjective thing. So patient has to look at those the stimuli points and they have to respond to that. Yeah, this is the current level of our technological development, where we have reached the version 9. So, and the TRL level and the manufacturer readiness level of the 9 for the thing. So this is the latest device where we have configured with all our the testing features. So when you look at this, the VR, you will be getting all these the options. And first, the Toby user calibration. So it initially does the calibration and the whatever the target fixations. So before we can collect this sample thing, so it will be directed with a laser pointer to you. So you can first perform for the demo. So once you click the demo, so you get that the demo features. So there will be a voice assisted guidelines for the visual field perimetry study. So there is a standard voice assistant guidelines, which is also provided with the native language of the patient. So that is the another advantage or the steps of what we have taken. So this will really help and reduce the screening time for the every patients. Once you complete the demo, then we go for the actual level of the sample collections. Then you get the direction for your the specific level of your the visual field study. So when we compare with the Ambry field analyzer, so our supra threshold method for this the subjective testing is very effective, and the doctors has felt it is a better level of the sensitivity, better level of the specificity, and the better level of the accuracy. So that way, so this technology has been replacement for the bulky level of the device. And today the doctors felt that so this technology is quite helpful and handy for the day-to-day affairs for the applications. Okay, so with this, let me end up with the note for my presentation. Okay.
Thank you, sir. Thank you for enlightening us about the topic virtual reality and how it is useful in healthcare medicine. And also, I was surprised to know that virtual reality was started by Ivan Sutherland in 1966. So I was thinking, when do we come to know about virtual reality? I recall the movie, Tamil movie Genes, where one more twin of Aishwarya Rai will be simulated using the virtual reality technology. And also, but these days, I think most of our people are quite familiar with the virtual reality, because even in YouTube they are buying virtual reality box and they're watching the videos with the help of the VR boxes. And also,
yes, sir. Yes, yeah.
And also, when you are saying about virtual, with the help of the virtual reality, we need not be watching the shoulder of the surgeon, and we can watch many people can simultaneously watch the surgeries. So people can learn it much better, you are saying. So one of our audience have also asked the question, does this will improve the students college fees, or is it cost effective, or is it going to be
no, it is highly cost effective. Almost it is already taken care of the technology interventions in your the tuition fee itself. Okay, so it is not going to increase anything additional.
Yes, sir. So during our first years also, like we will be having a single cadaver and 25 students will be there. So everyone will be running to get the first seats uh, to look at the dissection more clearly. So with the help of the virtual reality technology, I think this will be, all these problems will be sorted out, and I think we will get more hands-on on more technologies like intubation, IV lines, and all those things also, without doing much harm to the patient. Initially, we can train in the virtual reality technologies, and then we can practice in the real world patients, I think.
That's
So,
the most advantage when we are moving with the VR based level of the technology. It's a error free. So because you are gaining the utmost knowledge when you are playing around before you are touching for the patient.
okay, sir. So you have also added that this in the case study, instead of the Humphrey field analyzer, this C3 analyzer we can use to detect the glaucoma, to screen glaucoma earlier. You have also added that it is cost effective, and it is more sensitive and specific, and it is more accurate also. Are there any drawbacks in this technology?
Yeah, currently what has been observed by the all the clinicians, because we have sent our unit to the John Hopkins, and also other 15 units for the medical evaluation by the doctors. So their observations we have taken account. Now they are given the feedback that a mild glaucoma level of the conditions, so they are not able to 100% correlate. It is the accuracy is 95%. Okay, so that's where we are now focusing. Now we increased the normative data in our VIT, and also we are taking into the Aravind hospital. Currently, today onwards, the other set of the clinical trial already started with the Aravind hospital. So we are improving the mild glaucoma screening patients. That's where the drawback. So our people have noticed, and this is more compact, and the patient comfort, that is the key aspect. Because whereas if the elderly patient and the neuro patient, if you ask to put their chin rest and then look at the Humphrey field simulator for more than 15 minutes, that is for the testing, that we are reducing to 6 minutes. So it is a great support to the country.
Yes, sir. The compactness is also enhanced, and also the timing is also reduced. Yeah, we know usually to look at the patient's eyes using a slit lamp also, it is really difficult, because high intensity light will be passed into the eyes of the patient, and it will be quite discomfortable even for the educated patients. So, and also you have told that since it is portable, we can screen people at a mass level, the community level also, we can easily port we easily use it for a screening level also. So how long will this technology take to come into reality to such extent?
Sir, it is the matter of 6 months. So we are fine tuning the because as I already mentioned, we have already given the developed units to various doctors through the All India Ophthalmology Conference. So we have kept the stall, and we have already given the final version. So after the fine tuning all the features, so it will come to the commercial level of the units. So within the 6 months of the time frame.
Oh, okay, sir, that's really nice to hear. And also, while proposing our case study, I found that all the people are like almost related to technology field. So, what is the role of medical people or medical students in this aspect? In such,
No, actually, when you look at that, right from the design, we are collaborated with the Aravind Eye Hospital. So he is also one of the investigator in our team. Okay, so Dr. Venkatesh and his team, so Dr. Swati and Dr. Pavan and lot of glaucoma specialists, they are also, because without their input, we cannot fine tune or bring into this the level. Because right from the beginning, there the expertise and the experience how this the testing and the screening has to be done. So without there the inputs, we could not reach to this level. So from the day one, we got that because every week we have the regular interaction. So usually the Friday, Saturday, Sunday, we dedicate for this the technology and the innovation development activity. And so we are keep observing that what are all the remarks given by the doctors, and those remarks has been used for our the design correction. So that's where we have the continuous interaction with the doctors and the technologists.
oh, that's really nice to hear, sir. So, if a medical student is interested in such activities, means how can he gain more knowledge about that, and how can he practically collaborate with such people? Are there any
Yes, sir.
opportunities like?
Yeah, we have the platform called the Technology Business Incubator, okay, TBI. So if any medical professionals they want to associate with any of the technologists, so they can approach our the technology business incubations cell. So where the Dr.A. Balachandran, in fact, I am also associated with the TBI for the BIRAC and the Bioness level of the project activity, where we invite the students from the innovative level of the idea levels, and then through our the mentoring, we are bringing them to the startup level of the co-working area, where they can remotely connect or they can come regularly to visit our campus, and then they can start building their ideas into the reality in terms of the proof of concept, where initially we are supporting a student startup venture fund of the 1 lakhs. Now the government is promoting for the various schemes, especially for the Department of the Electronics and the Information Technology. Through the DST BIRAC, they are providing a idea to prototype. Even when any professionals or even any graduates, they are in the home also. So it is an entrepreneur in residence. Okay, they can apply through that the Mighty application. Mighty is the idea to prototype concept. Up to 4 lakhs they can get. Okay, then there is a concept for the Prayas fund. From the prototype idea, so sorry, from the proof of concept, you want to get to the prototype level. So there is another 10 lakhs funding support that is also available through the government of India to the all the TBIs. So in the Tamilnadu alone, we have the near about the 24 technology business incubator, which is spread over in Chennai, Vellore, and all the place. If any point of time, if any medical doctors they want to collaborate with us, then we can easily connect with the focused domain. So in IIT Madras, you have the healthcare sector technology part, which is inside. So they are also supporting for all this the collaboration activities.
Thank you, sir. This is a really useful information. So, all the viewers who are watching us, you can connect with Dr. Aruzhmozhivarman through his social media handles, which will be provided in the YouTube description. And also you can give your suggestions regarding the future webinars and how to improve us, and also the topics for the future webinars through our social media handles, which will be provided in the description. So that's the end of the session. Thank you, sir. Thank you for joining us in the session. So see you in one another useful webinar. Until then, it's Aravind signing off. Bye.
Thank you very much. So I'm ending with the note with the Swami Vivekananda: arise, awake, and stop not till the goal is reached. Thank you, GAIMS, for providing such a wonderful opportunity to interact with all the medical professionals. Thank you, Aravind.
Thank you, sir. Thank you for joining.
Thank you all.